Hello, everyone, and welcome to And Sleep, a Whole You social talk show series. My name is Tommy Licatese. For this multi-part series, in which we discuss the lifestyles that can impact our sleep health, I have the pleasure of hosting cardiologist Dr. Vinod Patel. Today, we'll be discussing heart palpitations and sleep. Welcome to the program, Dr. Patel.
Thank you for having me.
Let's talk about heart palpitations. What are they? What's the medical definition?
Palpitations are a term used for a patient. They can be manifestation of just simple anxiety, or it could be a manifestation of severe heart conditions, including atrial fibrillation.
You speak about the anxiety and stress. Obviously, these days with COVID-19, patients are feeling a lot of that. How would you tell the difference between heart palpitations due to an underlying medical condition or cardiac condition and just normal stress?
Mostly in a normal stress, patients have emotional element. They have a history of a panic disorder or stress in the past, and they build up gradually. While most of the cardiac conditions, they start suddenly and they stop suddenly. And that's the main difference.
What are some of those other underlying cardiac conditions that may be associated with heart palpitations besides the stress and anxiety?
Coronary artery disease, cardiac arrhythmias, including atrial fibrillation, can cause palpitation. Atrial fibrillation is a condition where your normal synchronized movement of the heart goes away, of the chambers goes away, and your atriums at the top chambers don't get empty completely, and that can lead to a clot formation in the heart.
Sounds pretty dangerous. What are some of the symptoms?
Atrial fibrillation can be experienced by patient as a palpitation, as we discussed. Sometimes patients feel tired, fatigued. They can end up having a congestive heart failure, and they have symptoms of heart failure, or unfortunately, 30% of the patients do not have symptoms at all. And some patients just appear with the stroke first time, and they have no idea that they have atrial fibrillation. When someone has a sleep apnea, they have a neurohormonal activation which leads to atrial fibrillation. There are 2 to 3 times more odds of having these two conditions together, sleep apnea and atrial fibrillation. So there's a definitive link between these two medical conditions.
So if somebody does have sleep apnea, what can they do to help them to prevent AFib?
The first and foremost thing to do when someone has sleep apnea is to lose weight. Do not drink alcohol at night. Do not take medication which decreases muscle tone. The second line of treatment is use of continuous positive airway pressure, which is not tolerated by about 50% of the patients. And we have a new therapy now, which has been tested and proven effective, is to use oral devices. CPAP devices are bulky, and some of the patients are claustrophobic because of the device. And therefore, I have a very good success with some of the patients who cannot tolerate CPAP, and they are tolerating these oral devices very well.
And you're seeing an improvement in cardiovascular health with the oral appliances?
There is no definitive prospective study. However, it makes sense to treat a sleep apnea when someone has both conditions together.
All right, great. Thank you for coming on to the show.
Thank you.
Well, that completes this episode of And Sleep, a social talk show series with Dr. Patel. We encourage you to explore the rest of the episodes and visit wholeyou.com to learn more about sleep breathing disorder treatment. The sleep professionals in this video series teamed up with Whole You to spread healthy sleep education across America and were paid for their appearances.